Hello guys and welcome to Nursing Essentials. Today we are going to be talking about skin dryness, and this is part of a series of videos that we're going to be doing on care of patients with skin problems. Now before we dive into studying skin dryness, we need to learn a little bit more about the skin. Before we actually get started, we're going to take a look at the layers of the skin. So we're going to learn about the composition, and we're also going to take a look at a couple of key functions of the skin that you need to keep in mind, okay? So first of all, let's take a look at the layers of the skin. And here we have a picture of the skin, and I want you guys to pay special attention to the left, the top left. And that layer that you see there, it's called the stratum corneum. And this is going to be very important because most of the changes that we're going to see with skin dryness are actually going to show up in that layer on top. Okay, so I want you guys to keep that in mind. And now to your right, I want you to take a look at the composition of the skin that we need to actually keep in mind. And basically, the skin is divided into three main layers. Okay, and if we start at the very top, we're going to find a layer called the epidermis. Now, the epidermis is the most superficial layer of the skin, is one that you can actually see, the one that you can actually touch. And its function basically is that it provides a waterproof barrier and it creates our skin tone as well. That's why I mentioned that this is the actual layer of the skin that you can see. If we keep going down, then we're gonna hit another layer. And if you take a look at the picture, you're gonna see there that the second layer, it's called the dermis. Now, as you can see, the dermis is thicker than the epidermis, and of course, it's gonna be beneath the epidermis, and it basically contains tough connective tissue, hair follicles. The sweat glands are also located in this layer, and it also has blood vessels. It's very vascular. So as you can see, the red and blue lines that you see there, those are blood vessels that are located as well in that layer. And if we keep going down, we are going to now find ourselves with another layer. And this one is called the hypodermis. Now, the hypodermis is basically the deepest layer of the skin, and it's basically made of fat and connective tissue. That is what you see on the picture at the bottom there. It's kind of yellow because of the fat that you can actually find in here. So those are the layers of the skin that we actually need to know and keep in mind for this episode today. Now, there's also some other key points that we need to keep in mind when we talk about the skin. And basically, one of the first ones is actually that it is the largest and heaviest body organ. Yes, the skin is actually an organ of the body. It also weighs about 3.5 to 10 kilos, which translates in about 7.5 and 22 pounds. One of the main functions of the skin is, and this is very important, is that it gives us protection from many environmental factors that could actually cause harm to the human body, to your body. It also protects the body from sunlight and, of course, from germs. This is very important because a good care of the skin will actually prevent infection. And this is something that we're going to see in later episodes when we go into more detail as how you take care of the skin, okay? Another very important function of the skin is that it actually gives us a sensory information. What is sensory information? It basically means that it will send messages to your brain, and it will tell your brain that a specific area of the skin is feeling heat, is feeling cold, is feeling pressure, is feeling itchy or pain, which is very important because, for example, if you're getting burned on one part of your skin, you want to take that part of the skin as far away as possible from that fire that is burning your skin, so that it doesn't get more damaged. Okay, so this is very important. Another very important function as well that the skin does is actually it plays a very important role in temperature regulation. And we're going to go into detail about that in some other videos as well, okay? But these things that we see here are the main key points that we need to keep in mind when we talk about the skin. Now, since we got that covered, let's jump right into our topic for today. All right, let's jump right into the main course for today. And as we said before, at the beginning of the video, we are going to be talking about a condition called dry skin. And of course, that condition has a name, and it's known as cirrhosis, okay? So, cirrhosis, it's basically another name for dry skin. And you may ask yourself, how do I know when the skin is dry? And this is going to be very important because one of the main reasons why we want to be able to determine when the skin is dry is because you can actually help the patient avoid many other complications that may be caused by dehydration, especially in older patients. So it's very important that you learn to actually recognize when the skin is dry. So dry skin might be seen as a fine flaking of the stratum corneum. Remember that layer that we talked about at the very beginning of the video? That stratum corneum is that top layer of the skin that is usually composed of dead cells. And if you see that the skin on a patient is actually has a fine flaking kind of whitish coloration on the skin, then you have to think about that maybe this patient it's dehydrated and this is causing the dry skin. So this is very important. The problem is usually going to be worse on the lower legs because of usually the blood flow is poor, so you might see more of this flaking in the lower legs. Also, another complication of dry skin, it's going to be pruritus. Pruritus is just another word for itching. And in patients with chronic skin conditions, unrelieved itching causes the patient to scratch and rub the skin in an attempt to relieve the intense itching. These actions, of course, may result in secondary skin lesions and also in excoriations, lichenification of the skin, and ultimately infection. Another complication of the skin, it's called the lichenification. And lichenification basically means that the skin has become thickened and leathery. So as you can see in the picture here, that's what we call lichenification. And this is going to happen with prolonged rubbing of the skin or scratching. And basically the outer layers of the skin, which is that epidermis that we talked about, that first layer, becomes overgrown. And this actually results in thickening of the skin and an exaggeration of the normal skin markings. So that is what is going to give the skin that leathery, bark-like appearance, okay? So when you see that in a patient, now you know that lichenification has occurred and the skin, for some reason, it's overgrowing and probably is going to be also irritated. All right. As a nurse, you need to keep in mind that cirrhosis is going to be worse in dry climates and high altitudes. Also, central heating air conditioning will reduce the humidity in the air and will increase the skin dryness. Extreme temperature, such as Wind, cold, and sunlight will also worsen the problem. Frequently bathing with harsh soaps, it's also a risk factor. If your patient has a skin condition such as eczema or psoriasis, then you might see dry skin or like a leathery kind of appearance on the skin. The skin is also affected by age, and as you get older, the skin gets a lot thinner and it also produces less natural oils. So, for elder people, it's actually a lot easier to show the symptoms of dry skin, which is why if you have an elderly patient, you have to take special care of the skin. And now the things you can do to help out a client or patient who is suffering from dry skin. And of course, your number one priority in this case is going to be maintaining a healthy skin. And there's a couple of ways that we can achieve a healthy skin, which we're going to go into detail right now. Another thing that you can do to help out your client is to help with hydration. You have to rehydrate the outer skin layers. This is one of the priorities as well. Of course, you want to relieve itching. If you relieve the itching, then you are, of course, going to prevent secondary skin lesions, and ultimately, you're also going to prevent infection, which is one of the things that we definitely want to avoid. Another thing you can do to help out your client is education. And in this case, I mean teaching your client how to use moisturizing soaps, oils, and lotions. There is a correct way to do that, and you need to teach your client that. All right. Another thing that you can do to help out is treatment of the underlying condition. If your client is having a condition such as eczema or psoriasis, then you need to be there and help your client achieve the complete treatment so that his skin can actually get better. Guys, always remember that lubricating creams and lotions seal in the moisture provided by water, and they promote suppleness and prevent flaking. And finally, guys, I want you to pay special attention to this word as a quick reminder, and that word is hydrophilic. Hydrophilic basically means that a molecule or substance is water seeking. In the case of lotions in the skin, if you apply a hydrophilic lotion to your client, it may actually draw water away from the skin, which can actually make the skin dryness worse. So always make sure on the label that you look for this word hydrophilic, and now you know that if you apply it onto dry skin, it can make your dry skin worse. That's it for today, guys. Thank you for watching. If you liked the video, hit the subscribe button. More videos are coming. Leave us a comment and tell us what you like to see on the videos. What topics would you like us to make a video on? Until the next one.